Good morning, everyone, and thank you for joining us for our first breakfast event for this year. I know Pam's kicked things off with a Better Work Tasmania session back in February, but certainly to bring together two fantastic programs, being the Employer of Choice program and also the Better Work Tasmania network. So I know some of you are probably from both sides of the fence, but we're bringing it together today, starting off with a breakfast followed by another event at 10 a.m. So really appreciate you getting out of bed early and coming along. Normally free breakfast isn't hard to sell, but as you know, there's no such thing as a free breakfast, so we will be calling on workplaces today to take action, hearing some great stories from our case studies, some expert advice from Graham Lynch, who's with us today as well. So please just don't, take in the information and sort of let it go to the bottom of the action pile. On that note, we do have an action plan on your table. So make sure if you're looking for a note page, that's the one. Hopefully you brought a pen with you as well. But really, some key topics to address and some timeframes to address that in. So I'm Cameron Blight. I'll be hosting today's breakfast, but you're not here to listen to me. You're here to listen to the speakers that we put out on the run sheet that you would have got. So just a little bit of housekeeping before we get underway. The exits you can see by the highlighted green symbols with run on them. So please follow me out the safest direction there. To the left there and out to the back of the room, the nearest safest exit. Toilets are out the door and around to the right. Food, tea, coffee, etc. Is out in the foyer. So please, at any time, feel free to go up and grab that. And there's lots of space today. So as you know, we don't like to sit for too long. So please feel free to use the space. Cartwheels, backflips, whatever this time of the day you feel like doing. Please make sure that you do. So today's event is proudly brought to you by Employer of Choice and also WorkSafe Tasmania and our partnering bodies there in ARI, Australian Institute of Management, and the TCCI. So we thank all our partners for coming together and delivering these types of events, which we hope that workplaces do benefit from and take things away to improve their own workplaces. And obviously, really, we do thank our speakers for coming along, giving up their time, to share their stories with you today. There's lots of resources on the table. The more that you take, the less that I put back in the car. So make sure that you do take stuff away with you. And we'll go through those throughout the morning. It'll probably take 10 minutes to go through it now, so I'll filter that throughout the morning. So without further ado, I'd like to welcome our first speaker today. And that is Graham Lynch. And Graham is the CEO of the Heart Foundation in Tasmania and plays an active role in the public health space. His roles include, and this might take a while too to get through a few of these, but he's the chair of the Health in All Policies Collaboration, hence that's one of our topics today, collaboration and innovation, driving productivity in Tasmanian workplaces. So great to have Graham sharing his expertise on that. He's chair of the Premier's Physical Activity Council. He's chair of the Tasmanian Chronic Disease Prevention Alliance. He's also a member of the Tobacco Coalition and has been a past chair. I think he had to give up a few of the chair positions because he's quite busy. And he's also a board member of Primary Health Tasmania. So Graham has a background in business with professional legal, accountancy, company director and commerce experience, as well as an interest in Tasmania's economic development and tourism. His interests outside business are wine, cooking, bushwalking and music. Graham is committed to influence social and health policy that promotes healthy lifestyles, addresses the social determinants of health and minimises chronic disease risk factors such as smoking, lack of physical activity, overweight and obesity. Welcome, Graham Lynch.
Well, good morning, everybody. It's great to be here at this fantastic facility. And what I love about it here is it's so accessible. You can walk in from the city, you can cycle, and it really is a great place to be. Firstly, I'd just like to acknowledge the Muwina people, who are the traditional owners of the land on which we meet, the original owners, and pay my respect to their elders past. I'd also like to acknowledge today's Tasmanian Aboriginal people, who are the ongoing custodians of the land on which we meet, and again to pay my respects to their elders past and present, and also to acknowledge any other Aboriginal or Torres Strait Islander people who are in the room here with us today. I'm from the Heart Foundation. I'm going to be talking to you very broadly about the work of the Chronic Disease Prevention Alliance, which is an alliance of the major not-for-profits in the chronic disease space, the Cancer Council, stroke, arthritis, kidney and, who have I forgotten, asthma. But just so you're aware of where the Heart Foundation comes from, our purpose is to reduce premature death and suffering from cardiovascular disease. And coming from the Heart Foundation, when you think about cardiovascular diseases, which are the diseases of the heart, stroke and blood vessel disease, the risk factors for those cover all of the risk factors that Cameron was talking about a moment ago. So from the Heart Foundation, we really have an interest in physical activity, nutrition, excessive alcohol, in reducing excessive alcohol consumption, reducing smoking, improving mental health in our community. So they're all risk factors for cardiovascular disease, so this is why we're so interested in this particular space. I just wanted to, as this is a sort of setting the scene a bit for the other speakers that we have today, and all the other speakers are going to give you a lot of good information about what they're doing in their workplaces. So what I was wanting to do was sort of set the scene a little bit higher about what's happening in Tasmania at the moment around looking at how we improve the health and wellbeing of all Tasmanians, and of course the workplace is one of those sectors. And I'd like to sort of suggest to you that as employers you're quite fortunate because people who are working are far more likely to be healthy or be exposed to better lifestyle decisions than people that aren't working. And one of the things that we've been doing with the Health and All Policies collaboration is really looking at how we get behind the causes of poor health in Tasmania. And I just had a quick look at the Work Health and Safety Act, which is the act that governs workplace health and safety in Tasmania. And in the objectives of the Act, it's about protecting health, safety and welfare. So health is there, and health means good health, and it's in the positive sense, but a lot of the focus in the Act is about protection of people in the workplace. And what I'd like to suggest to you is that there is an opportunity for us in all sorts of legislation and all sorts of policy areas in Tasmania to actually elevate health and wellbeing as an objective. So not only in your workplace are you trying to minimise harm that can come from poor equipment, poor procedures and so on, but also really taking responsibility for the health and wellbeing of your workforce. And you all know the advantages of having a healthy workforce in terms of people being available to work, having a pool of labour, when they're at work being effective and reducing absenteeism. So a big win we had the other day, which just illustrates how we can elevate health and wellbeing, is you would have all heard about the statewide planning scheme, which is something that the Liberal government was elected on and wants to implement a whole of Tasmania planning scheme. And we saw an opportunity to, in the machinery of the Act that was being changed just to facilitate the statewide planning scheme. So it was just a machinery thing to facilitate the implementation. But we saw in the Health and All Policies collaboration an opportunity to get an objective into the Land Use Planning Approvals Act, and you can read it there. It's a new objective, it wasn't in the Act before, and it's saying in the planning system in Tasmania, there's now an objective to promote the health and wellbeing of all Tasmanians and visitors to Tasmania by ensuring a pleasant, efficient, safe environment for working, for living and for recreation. So this is the sort of objective, over time. It'd be great to see that in something like the Work Health Safety Act that really is talking about the responsibility of everybody to get engaged in health and wellbeing. Sometimes we feel like this. On the left-hand side there we've got heart disease, and on the right side there's people like the Heart Foundation that are really trying to battle this huge, bulging monster that's really taking over our society. In Tasmania, this is just an illustration to show you that 54.6% of Tasmanians are actually living with 3 or more chronic conditions. So it might be heart disease, kidney disease, diabetes, for example. And you can see there that we're much higher than anybody else in Australia. But the message is, even if you go down to New South Wales, there's still 44% of people, 44% of their population that is living with 3 or more chronic conditions. So this is a huge issue, and you'll notice that those figures, these are the latest figures from the latest Australian Health Survey, and the figures on the right-hand side are where they were 3 years ago, and you can see in every state and territory, people living with chronic conditions with 3 or more of them is increasing. This is just looking at, in Tasmania, Compared to Australia, looking at people with cardiovascular disease, 28% compared to 21%. Hypertension, major risk factor for heart attacks and strokes, that's high blood pressure. And you can see there that in Tasmania we're 30% higher than the rest of Australia with hypertension. And you can read the others there. And you can see that Tasmania doesn't fare well against everybody else. But again, I make the point that it's not particularly strong right across Australia. I mentioned blood pressure. You can see, again, that's just where Tasmania sits in the red bar, significantly higher, as I said, 30% higher. So the chances of someone actually falling over in your workplace with a heart attack or a stroke is 30% higher here in Tasmania than it is anywhere else. Cholesterol is another major input into heart disease and stroke and diabetes, and again, you can see that Tasmania is quite high. This is just again showing another way of looking at the data, and you can see here that that's smoking at the top there. Smoking 3 years ago was 23.2% in Tasmania. Some data that just came out a couple of weeks ago, we now have smoking rates of 18.9%. So smoking has actually dropped in the last 3 years in Tasmania by 20%, and that's a really positive thing. The main reason for that has been, in the last 3 years, for the first time in 20 years, the Tasmanian government has actually invested in social marketing to go alongside the excise that's in place, smoke-free areas and so on. But the big thing has been an investment in social marketing to encourage people to make quit attempts. So when I'm talking about social marketing, I'm really talking about the ads you see on television that are running at the evidence-based level, and you can see what happens when there is an investment and when the evidence is followed, what can happen. Unfortunately, when you look at physical inactivity, you'll see that that's grown in Tasmania from 59% of people not following the physical activity guidelines, and that's just 30 minutes of physical activity every day, has increased to 67%. Now, what I would suggest to you, if we had the same sort of investment around integrated programs around physical inactivity, we might get a sort of result that we're getting out of smoking through the right investment. And again, Tasmanians who are not maintaining a healthy weight, or either overweight or obese, again is increasing, because again we don't have a comprehensive strategy to actually tackle this problem. But workplaces can really, and you'll hear later, that workplaces really can play a role with that percentage of the population that's working. So this is the problem we're facing. I think that data sort of illustrates to you that there really is a tsunami of growing obesity in our society, of people not being physically active, and that's being shown in the poor health outcomes. This is just something that was done in South Australia a few years ago, just to show you where we're heading in terms of expenditure. Everybody hears about the health budget. We all know that there's always going to be enough money to fund health and schools and so on. But this was some data that the South Australian Treasury did 3 or 4 years ago, and the red line is showing the growth in health expenditure in South Australia. And you can see the South Australian budget, which is the lighter coloured line, and you can see that they crossed over in around about 2010. So the cost of chronic disease in our community is huge, and I put it to you that the cost in your workplaces is also very high. So this is something that we're really grappling with around Australia, as to how do we contain health costs and keep our populations healthier. So really, prevention is a very important part in containing the obesogenic environment in which we live. Now, this brings us back to collaboration and the social determinants of health that Cameron mentioned in the introduction. And you can see there, this is mapping across Australia, so for each state and territory, the percentage of people that live in the lowest two deciles of socio and economic disadvantage. And you'll see that Tasmania is way above every other state and territory. So when we ask why we have poorer results in Tasmania, it really is connected to the socio and economic disadvantage that we have in Tasmania. The high rate of unemployment, the high low levels of achievement of Year 12 at school, unsafe environments in which families live, intergenerational poverty. These are all things that are really real in Tasmania. And you can see in Tasmania, 57.1% are in those bottom two deciles. Whereas if you go up the eastern seaboard of Australia, it's 16% in Victoria, 11% in Queensland, 30% in New South Wales. In the ACT, I should say, there's no one at a whole of population level. So this is really the big issue that we have in Tasmania, and that's where workplaces are so important, that the more Tasmanians we can get into the workforce, the better health outcomes we're going to have. And why do I say that? This is actually showing the deciles of the five quintiles, I should say, of socio and economic disadvantage. And you can see for each of those risk factors, there's a gradient. So on the left-hand side, you've got the people that most disadvantaged. On the right-hand side, you've got most of us, because we're all working, we're all pretty much in control of our lives. And you can see how smoking rates decrease as social and economic situation improves. The same with overweight and obesity, physical inactivity, and consumption of fruit and vegetables, which is a good indicator of a healthy diet. This is expressing things in a different way. What we have here is education and health disparities in Australia. So you can see on the left-hand side, if we go right over to the far left, it's people who've attained, in the 25 to 44 age group, who've attained Year 11 education, how they rate their health, their poor health. Then we go to Year 12, and then to people who've got tertiary education. So you can see that education is one of the biggest predictors of health and well-being in Australia and in Tasmania. And again, this explains why in Tasmania we have such poor statistics, because we have so many people in our communities that don't go through to Year 12 and participate in tertiary education, with so many people leaving in Year 10. So you can see that if we're going to really address the poor health outcomes in Tasmania, we really have to look at these underlying causes. It's not really the health department, it's education, it's justice, it's transport, it's employment, it's all of these sorts of health and all policies, government policies that are going to improve our outcomes. There was an inquiry that just reported recently from the Joint Parliamentary Select Committee, which was something the Health and All Policies Collaboration really pushed for 3 or 4 years ago. It reported just a few weeks ago, and most of its recommendations are around how the Tasmanian government needs to take a health and all policies approach. For example, putting something more positive into the WorkSafe Act about the obligations for employees to look towards the health and wellbeing of their staff, and also about addressing social determinants of health. So it's saying really that the health and wellbeing of Tasmanians requires a health and all policies and looking at the underlying causes. That committee had 3 legislative councillors and 3 members from the House of Representatives, and all the 3 political parties were represented, and they came up with a consensus report. So that's really, really positive. Just really quickly, the Heart Foundation works in these areas, so we're very much engaged in what we call Healthy Hearts. So that's looking at the food supply, encouraging people to eat healthier, to be physically active, and of course tobacco control, which is still the low-hanging fruit in Tasmania. Even at 18.9%, it's nearly 1 in 5 Tasmanians are still smoking. Heart care, which is the work we do around the health system itself, the white-collar sort of work. Equity, which is what I've been talking about. You can see why it's so important for somebody like the Heart Foundation to be involved in health and all policies and social determinants. And of course research. We're the largest funders, non-government funders of research in Australia, and over the last 3 years we've actually invested 1.8 million in research here in Tasmania. We have about 10 people working on Heart Foundation grants on research projects in Tasmania across all of those areas. I guess the final thing I wanted to say to you just about risk factors is we're identifying now that over 11 million Australians spend an average of 8 hours per day in workplaces. So these are the lucky people, these are the people that are working, so their health outcomes should be better. But one of the really big problems we have is that sitting in front of computer screens, not standing more and sitting less, is a real independent risk factor for all of the chronic conditions we've been talking about. So I really encourage you all in your workplaces to look at how you might be able to get people moving in your workplace. Standing desks, for example, are a great thing. We've got them in the Heart Foundation now with all of our staff. They cost about $1,200. You can pick them up and put them down during the day, and that encourages people to move, to stand. And it's amazing when you've got a standing desk, you tend to walk around the office a lot more because you're already on your feet. So we have a lot more sort of face-to-face communication rather than email or telephone conversation because of that. So it's something, it's easier to do in workplaces where you've got a clerical workforce. I know it's much more difficult for those of you in the logistics and transport business and so on, but it really is something that we need to look at because the benefits of being physically active in the morning, for example, going for a run or going to the gym or going for a walk with the dog in the morning, can easily be offset during the day by sitting all day. So there's lots of things you can do in the workplace to encourage less sitting time. Just to close off, there's an opportunity at the moment. The Tasmanian government, as part of its election campaign, Healthy Tasmania was a core thing that the Hodgman government is wanting to implement, with the goal of making Tasmania the healthiest population in Australia by 2025. Ambitious goal, but if we start to address some of these health and all policies, these determinants, we could make big gains. But it is going to require investment, and the government is currently working on a 5-year strategic plan for preventative health to look at ways that we can improve the health and wellbeing of Tasmanians, and that should be reporting shortly. And certainly we're putting a lot of pressure on the government to make an investment that's more than the 1.7% of the health budget that goes into prevention at the moment. The standard around the world in countries like Canada and New Zealand is about 7% of the budget. So we're certainly working with the government to try and encourage more investment like the investment that I showed you earlier on that reduced smoking rates. Finally, if you haven't got an AED in your workplace, I really encourage you to contact Ambulance Tasmania and they'll help you through that process. An AED in your workplace is not just for your workers. It can be registered and it can affect everybody in the area or in the community in which your workplace is located. And that's a map of showing where these AEDs are. So Ambulance Tasmania, if you call them now and you've got an AED, it'll automatically come up on the screen and they'll send you an SMS and telephone to say, if you've got a defibrillator, can you take it to the site of where someone might be having a heart attack? And we'll leave it there. Thank you very much.
Thank you very much, Graham. Obviously, I didn't press anything then. I think we're doing a switch. Certainly setting the scene today for workplaces that are here enjoying breakfast, but also more importantly, what can you take away from today to take action back to your workplace? And you certainly won't have a shortage of options that we put forward today. So thank you, Graham. On that note, and I know he did talk about sitting time, so I'd like you to stand up. I'd like you to turn to the person next to you. You've got 30 seconds. What were the key points that you got out of Graham's talk then? So 30 seconds, key points, and halfway through I'll call a change and the other person will talk for 30. Away we go.